Hello friends, I am Dr. Vishweshwaran, currently working as a consultant interventional pulmonology and sleep medicine specialist at Yashoda Hospitals, Somajiguda in Hyderabad. We all know that we are currently observing the Idiopathic Pulmonary Fibrosis Awareness Week between September 17th and 24th. Idiopathic pulmonary fibrosis is one of the most common form of a group of disorders that affects the lung, which we refer to as an interstitial lung disease. Basically, in the interstitial lung disease, there occurs a scarring of the breathing apparatus of the lung, which we refer to as the lung parenchyma, which makes the patient lung capacity decrease, and thereby it contributes to breathlessness and cough. Of all the interstitial lung disease we know, IPF or the idiopathic pulmonary fibrosis carries one of the worst prognosis, and it is associated with an increased risk of mortality. IPF generally occurs amongst men or women who are smokers, predominantly beyond the 5th or the 6th decade of life. However, certain cases of IPF can occur at a younger age and even amongst non-smokers, especially when they have a genetic predisposition or they have a strong family history. So, whenever a patient is suffering from an idiopathic pulmonary fibrosis, they generally complain of intractable dry cough, they complain of difficulty in breathing while walking, and in certain cases, they may also complain of a swelling of the tips of the fingers, which we medically refer to as clubbing. But in case if a patient of an IPF complains of some warning signs such as bleeding while coughing or significant loss of weight or loss of appetite, then we need to actively screen for lung cancer even in these patients of IPF. So whenever you are being evaluated for idiopathic pulmonary fibrosis, your doctor may ask for a HRCT of the chest, which exactly picks up a particular pattern of presentation in the HRCT, which is classical of an IPF. But however, in doubtful cases, your pulmonologist may ask for certain bronchoscopic biopsies of the lung to confirm a case of an IPF. In addition to this, you will be asked to undergo few of the breathing test, which we refer to as the PFTs or the pulmonary function test, as well as a 6-minute walk test to assess your functional capacity. Unlike the past, the treatment for the IPF has evolved significantly, and we have numerous medications which can slow down the progression of an IPF in your patient. In addition to this, for patients who become dependent on oxygen or whose functional capacity is significantly impaired, they become the candidates for lung transplantation, and lung transplantation in these patients can provide a second phase of life to these patients who are chronically suffering from IPF. In addition to this, supplementation of oxygen, taking care of symptomatic management of the cough, the breathing issues, as well as involvement of the palliative care provides a holistic management in the treatment of IPF. So let us stop smoking, let us prevent IPF from happening, and let us breathe a healthy air to have a healthy lung. Thank you.